My name is Kelly English, and I'm from the Arthritis Patient Advisory Board for the Arthritis Research Canada. And I'm here today with Dr. Sasha Bernatsky, hope I pronounced that right, an Associate Professor of the Department of Medicine for the Division of Rheumatology, Faculty of Medicine from McGill University. And today we're going to talk about one of your specialties, cancer and systemic lupus. And I'm going to ask you to tell me a little bit about yourself and how you got into this field.
Okay, I'm I'm a rheumatologist, and I call myself an epidemiologist because I have some research training in that area. So much of my time is directed towards research, and I became interested initially in the subject of cancer in systemic lupus and other diseases because of Anne Clark and others who were my mentors during my formation. So that was actually part of my thesis work.
Okay. And what are some of the things that you've presented today that have sort of been different?
Well, today we had the chance to produce some new data on cancer risk in incident cohort of lupus patients. So this is a sick cohort. And the work that has been done to date has not necessarily focused on incident lupus patients. We wanted to do this new look at cancer risk, looking at incident patients from the time of diagnosis forward, so we could get a clearer picture of what the cancer experiences was during that whole time period.
And what did the research do?
So we interestingly found that the cancer experience of these patients in the follow-up period that we have had so far has not been greatly elevated compared to the general population, which is consistent with some of the other data. When we look specifically at hematologic malignancies, so those are lymphoma and related cancers, the other data that we've produced thus far has suggested 2- or 3-fold increased risk of these relatively rare cancers. In the incident patients, we found about a 2-fold increased risk, only for cancers absolutely, but about a 2-fold increased risk if you compare that to the general population. However, because of the small number of events, you can't say for sure that this is really that much different compared to the general population. So one thing that we did find that seemed fairly clear is an increased risk of lung cancer in these patients, which was something that we had seen in our other studies. So again, this is based on only 6 lung cancers throughout time in this almost over 16,000 lupus patients. But because of the importance of lung cancer being what we might call a preventable disease, we looked at smoking as a risk factor for these cancers in our lupus patients, and it turned out, of course, that most of these individuals who developed a lung cancer had been or were smokers. So that again really resonated with the past work we had done, which suggested that in lupus, lung cancer was at least in part driven by smoking as opposed to things like drug exposures. So although the results aren't definitive, I think we can really use that information to help counsel our patients to encourage them to cease smoking if they currently smoke.
Actually, with most of our drugs now and everything else, we all should be encouraged not to smoke.
Absolutely, there are so many reasons, and hopefully we always have been doing that, but it's always nice to have some information that will help people make that sometimes difficult transition to become a non-smoker. But it is very interesting because several of the presentations this morning emphasize that need to try to quit smoking with people.
I know it's difficult.
It can be.
You've just had your diagnosis, you're in pain, and now we're going to add another thing.
Exactly.
But now, does exposure to smoking, does that make a difference as well? So in other words, if you don't smoke as a lupus patient, did you find that
Like
having
secondhand
smoke?
Right. We don't have information on that in the data sets that I have. Theoretically, It could be.
Okay, so it's not a jump out thing yet, but it's one of those things we should watch out.
I think we all need to make the same
Given
kind
it
of health,
twofold.
same kind of
Yeah.
health choices as a lupus patient as you would as a non-lupus patient in terms of trying to limit your exposures.
Okay. And how are you finding, have you checked with other rheumatologists across the country, and are they giving that same message out?
I think we've been fairly consistent in our beliefs that encouraging people to make healthy choices, including ceasing tobacco use. However, one of the things that I think we're all challenged by is the amount of time that we have to spend with a patient.
Absolutely.
So we are hopefully all doing our best to try to include a little bit of time to counsel patients to cease tobacco use if they are using tobacco, but we also need the help of more than that. We need the help of non-rheumatologists and allied care and everybody, hopefully bringing across the same
Bring that
message.
message, right. Now, in lupus care, is that one of your specialties, other than just this research?
Well, fortunately, I have, in my clinical work at McGill, I have the wonderful experience of working in the McGill Lupus Clinic, which is a wonderful, large, and very well-developed resource directed by Christiane Pinault, with Evelyn Vinet and Ferris and Louis Pierre, who are also part of our clinic. And it's at times challenging, but very satisfying.
I'll bet. Now, in the last 5 years, maybe 10 years, we know that rheumatoid arthritis has taken huge jumps. What are you finding in lupus? Have you found differences in care treatment or diagnosis? Or?
So, it was said this morning that patients with rheumatoid arthritis now have a much better choice of therapies compared to years ago. I'm starting to feel the same for lupus patients as well, and other rheumatic conditions that we have. I'm very excited by the developments that we've seen slowly across time. I think we're getting there, but we still, I think, can benefit from additional research on how to use the data that we have, and hopefully also additional therapies that we can use for people who may not respond perfectly to the drugs that we currently have access to.
Now, are the lupus patients in your clinic, are they on a fast access too, so fast track, because of the fact that I know that with rheumatoid, if you get early treatment and you get it early, we figure there's a lot better outcome. There's actually research on that. But is that the same with the lupus, especially due to organ involvement?
Yeah. There's a suggestion, certainly, that we should be aiming at preventing damage in lupus, because people like Dr. Urwitz and Dr. Badman their work some time ago has suggested that people who get organ damage in lupus are the ones who may continue to do poorly. And I think groups like the Canadian Network for Improved Outcomes in Systemic Lupus, or CANIUS, are really focused on trying to document access and determine disease burden and outcomes. I feel that we need to get a better picture about what access to care means in lupus, and one of the things that is really going to help us, I think, is perhaps the work that CANIUS members and others are doing, looking at developing guidelines to care in lupus. So Stephanie Keeling is somebody who spearheaded that effort, and we had some presentation of those guidelines earlier in the meeting.
Right. I was reading some of the posters too, and I noticed there was a lot of lupus posters yesterday, which is, I think, for lupus patients, they're as well grasping for information, and I think this is wonderful to see coming out.
Yes.
Perfect. Now, Anita, do we have any questions from our audience?
So there's a question of, for someone who wants to quit smoking, what are some helpful resources that you know of that would help?
So I don't know if we're going to have a print version, but I did send a text, a link to each province has a sort of a smoking hotline website. So if you have access to that, you can Google, smoking cessation. And in addition, you can certainly go to your physician. Your primary care doctor, your rheumatologist should be able to get you started off in the right direction. If you wish to discuss options with a pharmacist, sometimes they can point you in the right direction. So that's a good place to start.
Perfect. And I know access has improved greatly in BC.
Wonderful.
Thankfully, you can actually get help, and medications are paid for to help you smoke. So really that's a message we're trying to get out. I think across the board, we know that AS improves in pain level with the cessation of smoking, and we know that there's a possibility of lung cancer. That was the major one that you found then.
There's so many reasons.
For cancers.
Mhm.
Yeah.
So many reasons.
So yes, it is in general as well, but definitely for our patients.
And one more question. Do you have any lifestyle tips for someone living with lupus?
So lifestyle is important for any person trying to live well with a chronic condition. Aside from attempting to cease smoking if you're a smoker, the other things that are important are those lifestyle things that's important for all of us. So exercise, eating a healthy diet in as much as we can, and also I think we need to be aware of the effect of stress on ourselves, and this is going to be different for everybody, but trying to figure out how we can manage our stress levels, I think, is important. One of the things at McGill that we've started to focus on is mindfulness, which is a really general approach to stress management and being aware of stress and dealing with it. So I also included a link to a fun video on YouTube.
Oh, perfect. Thank you, because definitely mindfulness, it does make you aware of.
It's important.
Even if it's not gone, you at least are aware of it.
Sure.
Yes, it is a big help. Thank you so much for talking with us.
Thank you.
That was great.
Thank you.
Thank you.